So this is my COVID-19 story. Yeah, that happened. I showed the first symptoms on January 7th. Coughing. I just started coughing. And it came on just like that. It was like a switch went off. Remember I was talking with a buddy at work and it's just this cough came over me. And I couldn't stop it. I went and up to the corner store and got a Dr. Pepper to drink, and hopefully the fizzy cola would help with the cough, and it didn't. I kept coughing. I knew something was up the next day, so I went to the doctor. He said, well, you know, you've got some sort of flu bug. We're going to give you some Z-Pak, azithromycin, and a steroid shot. You'll be right as rain. And usually, that's exactly what happens. I get a Z-Pak and a steroid shot. In a couple days, I'm right as rain. This time, the azithromycin didn't scratch it at all. The steroid didn't have any effect. And by the time I got back to the doctor the next week, I was doing nothing but coughing. I couldn't even talk to the doctor hardly at all without coughing. I coughed the whole time. I was coughing constantly. And he said, well, you know, maybe you've got valley fever. Now, for those of you who don't know, valley fever is kind of common in California's Central Valley. It's a fungal infection of the lungs. California, at least here, is a really dusty area. Lots of dust in the air from all the industrial farming. And so when they plow the fields or do something out in the fields, the fungus that's in the topsoil gets airborne, travels around, gets in your lungs. Bob's your uncle, you've got valley fever. Valley fever is kind of a degrading kind of disease. It will do lifelong damage to your lungs. Lifelong. Not a good thing. So they did some chest x-rays, tests for the flu, make sure if I had the flu, and valley fever. A few days later, we know you don't have the flu, guaranteed you don't have the flu, you don't have valley fever, we're really not sure what's wrong. So we've got this viral panel, whatever the viral panel is, we can do, but your insurance won't cover it. So they, okay, if it's $100 or whatever, yes, sure, fine, I'll pay for it. Well, how much is it? $3,200 for the lab test. $3,200. I said no, couldn't afford it. So I got a different antibiotic, more steroids, nebulizer, albuterol. Weeks worth of that didn't work. In the end, I went through 4 different types of antibiotic rounds, 4 different types of steroid shots, not including the nebulized albuterol. And 5 weeks later, as soon as it came, it vanished. The coughing stopped like a switch. Got literally a switch. It stopped just like that. I no longer had the urge to cough. But 5 weeks later, and let me tell you, my breathing sucked. It was really bad. It got to the point that when I was going to bed at night, I was wondering if I was going to wake up the next morning. That if my O2 level, my bloodstream would just shut everything down. And the really sad and scary thing is I was so sick that if I died in my sleep, I was okay with that. I was so sick that, oh God, you know, if I die in my sleep, well, at least I won't be sick. Thank you, COVID-19. And back in the first week of January, very little news had come out about COVID-19. Mostly, as we know now, that it was kind of hidden by the Chinese. They were lying through their teeth about it. I think they're still lying through their teeth about it. So I didn't know not to wear a mask. No one knew to wear a mask. No one knew it was even a thing. No one knew it was in America, January 7th. God knows where I picked it up from. So anyway, because I wasn't wearing a mask, I know I gave it to another guy at work. I know I did. Because once he incubated, he came down with the very same thing. Well, he's older than I am, an older gentleman. And it stayed with him for about 7 weeks. And he was really sick. He was much sicker than I was. And I know I gave it to him. And dude, Meryl, I am so sorry I gave this crap to you. I just didn't know. Nobody knew. And he had to suffer because I just didn't know. So in May, I took a COVID test. And since I'm an essential worker, working in aviation, took one negative, but also took one for the antibodies. Well, guess what I was full of? I was chock full of antibodies, man. My antibodies were as thick as honey. They were just everywhere. So I wonder where I got those little rascals from. Let me think. Where could they have possibly have come from? Oh, yeah. That deathly sickness I had back in January. So I ask you guys to wear a mask. Yeah, I know we're all recovering. We're reopening America. A lot of states still have coronavirus growing. Not reducing, but growing in number. New cases every day. More new cases than the day previous. And according to Johns Hopkins, California is on the rise. Still, in June. So we're not out of the woods yet. We're nowhere near out of the woods. And I know we're all reopening. We're all glad things are trying to return back to normal. But I want you to wear your mask. And as it stands now, a lot of people say, well, you know, flu only kills 23,000 people a year. And that's kind of the rolling average over the last 20 years. So why are we doing all of this? Well, yeah, the flu does kill about 23,000 people a year in America. But we passed that number a long time ago. So where we are now, at the end of May, we had 4 times as many deaths due to coronavirus in America, and it was only May. We hadn't even made it to June, and we were already 4 times the death rate. 4 times the death rate of what influenza, the flu, is. And that is with all of the social distancing, quarantine, stay-at-home orders, shutting down non-essential businesses. That's with all of that. We still have 4 times the death rate. And now here we are in June. Some of those populous states, the infection rate keeps going up. Specifically California. We don't need a second wave of this. And second waves are dangerous. Let me tell you a story about my great-grandmother. She survived the first wave of Spanish flu. She didn't survive the second. She came down sick, deathly ill. She was in Hinton, West Virginia. They put her on a train to either Beckley or Charleston, West Virginia, and to a sanitarium where they treated Spanish flu. Or at least isolated people, or took care of them as much as they could back in those days. And that's the last anybody saw of her. The family doesn't have any records of where she's buried. or if she was just cremated. We have no idea. But the downside of that was it left my grandfather, as a 4-year-old, more or less an orphan in the coal fields of West Virginia. Not a pleasant situation for any child to be in. So these infections, pandemics, can have wide-ranging consequences. So the second waves of pandemics are historically a thing. They're very dangerous. So until we get out of all this mess, which won't end until we get a vaccine, please wear a mask. It's the least you could do. At the grocery store I went to last Monday, every time this has happened, I've always keep a census in my head. How many people in the store, how many people wearing masks. And out of 48 people, I was the only person with a mask. Me. I'm not wearing a mask right now because I'm in the middle of nowhere, and probably the closest human is about 5 miles away. So wear a mask. Please wear a mask. If you don't like the one you got, get a pretty one. Get one with flowers or something, or get a Batman mask, or get a Darth Vader mask. How cool are those? Or a Stormtrooper. Get something to cover your mouth with. So that's the end of my COVID-19 story. I really hope it's the end of my COVID-19 story. I mean, seriously, right? If you have any thoughts, leave those in the comments below. And please hit the like button and subscribe if you like the content I'm putting on this channel. So until next time, please wear a mask. A mask, that's all I'm asking. It's just wear a mask in public. Y'all stay healthy.